I am Dr. Daniel Riordan. I am a naturopathic doctor that is board certified in biofeedback, and I am a co-owner here at Junction Naturopathic Medicine. I actually was brought to naturopathic medicine by my mom. She taught nursing, and I originally was going to go into medicine. I was going to do the traditional route. I had already done my MCAT, and I had spoken with some doctors. This was before the Affordable Care Act, and they said, medicine just isn't what you think it's going to be. The insurance companies kind of regulate what you can do, and if somebody doesn't have insurance, you just kind of put a band-aid on it, knowing they'll be back soon. So she told me there's this different kind of medicine called naturopathic medicine, and I ended up applying to Bastyr here in Washington, and that's how I got into the field. Naturopathic medicine is more about the person being a big form of the medicine. There's all different kind of options that we have. Pharmaceutical is still an option. I still do a decent amount of pharmaceuticals with people, but a different form where we use supplements a lot more. We focus on dietary and lifestyle management. We really get to the root of the problems instead of just dealing with the symptoms. We are all primary care doctors, and then there's specialties beyond that. We do a lot of hormone replacement for people. We do a lot of laboratory testing, so just annual blood work for people. Pain management, anxiety and depression, big thing for us that we do here as well. I focus more on naturopathic medicine as far as men's health goes. Testosterone being a big part of that, of course. Erectile issues, decreased mood, decreased energy, prostate cancer screenings, annual screenings in general, but a big part of that definitely is the testosterone labs, and then also replacement if need be. However, I do a lot of work with anxiety and depression. I use biofeedback as a big modality for that. Biofeedback is really for a lot of different health concerns that people might have. The top reason I use it is for anxiety and depression. Your breath work has a huge impact on the vagus nerve, and that regulates which one of those we're in, that rest and digest or that fight or flight mode. So people with anxiety, people with high blood pressure, you can use your breath work to then impact that nerve and then put yourself in the more relaxed state so that you're decreasing your blood pressure, you're bringing your anxiety level down. So a lot of our advantages in naturopathic medicine is really that we get the best of both worlds. Like I said, I still have a prescriptive scope, so I can still go over all the prescription options with you. I personally usually tell people, hey, here are your options as far as supplements go. Here are your options as pharmaceutical go, and then here are your options for dietary or lifestyle management. And then we go over the pros and cons of each. Supplements are great because they technically have less side effects usually, but there's also costs associated with that. I know that insurance companies don't cover supplements, so it can be expensive. So I will usually go over, here's what a supplement is going to look like, a monthly cost for you. Here's what insurance company is probably going to give you coverage on as far as a pharmaceutical goes. And then as far as lifestyle management and nutrition, we have an honest conversation with you. Is this something you can do at the time? And it's not realistic for everybody to get the 150 minutes of exercise in every week. We're really busy with work, we're really busy with kids, so if that's not a great option for you, we can definitely talk about the supplement or pharmaceutical route as well. Naturopathic medicine's role in the future is to really just bring back really good primary care. Like I said, we get to spend time with the patient, we get to know the patient. A lot of times that means we get a lot more trust with the patient just because the patient knows us more. When they're told that they should get this vaccine or they should try this drug, a lot of times patients will come and ask us about it. They'll say, hey, what's your opinion about it? I want to know what you think about it. Doing those really good just annual screenings, catching cardiovascular issues before it becomes a really big issue, catching things before people have diabetes, doing those really good labs just to make sure that people are in the optimal health and catching the issues before they occur to begin with, before the damage is done. People that want to switch from a traditional doc to us naturopathic doctors, just give us a chance. I think some people are worried about, it being different. Different can be a bad experience for some people. It can be scary, but different can also be good. It can be a second look at what's going on with you. It can be that other opinion that maybe goes a little further in depth and that gives you the personalized care that you're really looking for. And in the long run, it can optimize your health that way. Junction Naturopathic Medicine is located in the Alaska Junction of West Seattle. We are in the heart of kind of the downtown area there. We're right by the record store.